We're now on to the diseases and disorders. So we finished the structure and the names of the bones. So we're on the last leg of the skeletal system. But there is quite a few diseases, some of which you've probably already come across. So as we said earlier, arthritis is inflammation of the joint. We can have inflammation in the joint in one joint, which is monoarthritis, or we might have polyarthritis, which is inflammation in many joints. This is often, in the first instance, this can be redness, swelling, pain, inflammation, and as you go further down the line and have a more chronic condition. Now, an acute condition is something you've never had before. So if I suddenly developed redness, heat, pain, and inflammation in a joint, never had it before, that would be acute arthritis. But if I'd had arthritis for a long time and it become chronic, then I might end up with loss of cartilage as it progressed as a condition. Gout is a form of arthritis. This affects mainly men and mainly the big toe, but more and more women are suffering from gout these days. And gout is caused by a build-up of uric acid crystals within the joint capsule, which deteriorates the joint and causes a sort of chronic joint destruction long-term if it's left untreated. It's extremely painful, and the joint is usually very shiny and really swollen, and the person can't stand you to touch it. Often in the big toe, but you can get gout in any joint in the body. It can't be treated for the first time, so an acute condition, it's very hard to treat, but it can be treated by tablets that you take which reduce the build-up of uric acid crystal in the body. Now, uric acid is produced by the liver, and sometimes if the liver's not working, maybe because the person drinks a lot of alcohol and the function of the liver is inhibited, or they eat a lot of protein. You see, uric acid is a byproduct of protein metabolism. So if the liver's not working properly and it's maybe too busy processing alcohol or processing an excessive amount of protein, then you have more uric acid in the body. So gout was always considered to be a wealthy person's condition because they drank a lot and they ate a lot of rich food. And there is a diet for gout, which is usually white fish, white meat, and a reduction in alcohol. So gout, form of arthritis, usually because of the uric acid crystals found in a joint. So it's the buildup of uric acid crystals. Osteoarthritis is a type of arthritis that you tend to get in the weight-bearing joints with old age. So it's normally where you've maybe had a previous injury, it's age-related, and a degenerative crumbling of the joint. Maybe the knee, the hips, anywhere that's weight-bearing in the body. The pain is said to ease after 20 minutes of movement. So this tends to happen in joints when you get up in the morning, when you've been sitting for any length of time, and you find that once somebody moves around for 20 minutes and the synovial fluid pumps into the joints with movement. So this is why we tell the elderly patients to get up and move around on regular basis, so that the synovial fluid is pumped into the joint and can then lubricate the joints, and after 20 minutes you get a lubrication, you get an ease of movement. But about 85% of people over the age of 70 years of age will have some form of osteoarthritis. So it's age-related, degenerative crumbling in the weight-bearing joints, normally easing after 20 minutes, but it's age-related. So rheumatoid arthritis, this is very different. This is an autoimmune disease, and you don't have to be elderly to have rheumatoid arthritis. It's normally diagnosed with a blood test. You'll have stiff, achy joints, maybe a bit of swelling, inflammation, but it's the body fighting itself. Autoimmune disease means that the automatic immune system that we have in our body starts to not recognize the joint as being part of us, and it starts to attack the synovial membrane, causing deformities to the surface of the bone. So in this picture we can see quite a lot of deformities in the hands in particular. But rheumatoid arthritis is an autoimmune disease. It's not the same as common or garden arthritis that we get in older age. Ankylosing spondylitis. Spondylitis is an inflammation of the spondyls of the vertebral column. This is usually affecting the vertebrae somewhere along the spine, and in this case it's often lower spine. It's an acute or chronic fusion of the joints. So if you think of anchoring, this reduces the mobility and movement in the joint, often resulting in the joints fusing together and not even allowing that slight movement that it's supposed to allow. People will often have these joints fused together. Osteoporosis, this is also known as brittle bone disease, and it's where the bones become porous. The age group that this affects is always post-menopausal women. It doesn't affect men at all. And it's a disease that affects not only the calcium deficiency that causes it, but it also is the lack of estrogen. When we go through the menopause, the estrogen and hormones reduce to such an effect in the body that they can cause the bones to become brittle. So it's usually a combination of calcium and estrogen deficiency. There's an acceleration of bone loss. You might lose height quite rapidly. It's also known as brittle bone disease, and in the 70s our hospitals were full of elderly women with broken heads of femur. This is where they brought in HRT, hormone replacement therapy. So now they give postmenopausal women quite often an HRT in order to put back the estrogen and the calcium in the body and prevent osteoporosis, which is brittle bone disease and affects postmenopausal women who have a lack of estrogen and a lack of calcium. Synovitis is inflammation of the synovial capsule and membrane of the synovial joint. It's inflammation of the synovial membrane. It's usually very painful, particularly on motion, and is characterized by swelling, and you can have this in any of the freely movable synovial joints. A ganglion, which we can see on the back of this hand, is a cyst either in the tendon or the sheath or the joint capsule, which produces a tense, round, painful swelling, seen almost only on the back of the hand or wrist, and sometimes you can have them on the metatarsals of the feet. They used to smack them over the head with a book in order to disperse them, but thankfully that treatment seems to have gone out the window. But they do come up very quickly, but they go equally as quickly, and they're not really a problem with the function of a joint or a bone. So that's a ganglion. Bone cancer is a primary cancer. We have primary and secondary cancers, and a primary cancer is the very first point of development for the cancer. Quite often a part of the primary might break off, travel around the body in the lymphatic system, and then where it deposits itself is known as a secondary. There's only about 500 cases in the UK a year of bone cancer, and it's quite a rare type of cancer. Loss of limb is in your syllabus. There's a lot more people these days losing limbs, either because they're diabetic and they have to have an amputation, or especially in the Far East, there's an awful lot of bombings, and we tend to use loss of limb then as a result of mines and accidents and sometimes illness, as I said, because of diabetes. A prosthesis or a prosthetic is a mechanical device that's fitted to the arms and limbs in order to aid in normal function. We need to know about some of the fractures in the body, and the ones in your syllabus are simple, compound, complicated, comminuted, green stick, and impacted. A simple fracture is a fracture that's just broken in one place. A green stick fracture is usually in a child, and it's maybe an incomplete fracture in as much as it's not gone all the way through. And you might get more of a bend in the bone in a child rather than an actual snap or break. An impacted fracture is where the two bones drive into one another, and sometimes you'll get shortening of a limb because of this impacted fracture. A comminuted fracture is broken in lots of places. I tend to remember this because I think of when I was a child, I fancied joining a commune, and a commune was a place where lots of people lived together. So for me, comminuted is lots of little fractures and breaks. A complicated fracture is when it's complicated with organ damage, maybe blood vessel damage. So it's more complicated. It's not just to do with the bone. A compound fracture is when it sticks through the skin and you can see it visibly externally outside of the body. Obviously, you can have different types of fractures. So you could have a compound impacted fracture, or you could have a comminuted complicated fracture. But basically, there are 6 fractures in your syllabus, and you might get a question about which is complicated, which is comminuted. Osteomalacia is a softening of the bones due to a defective bone mineralization. So these are minerals in children. It could be due to bad diet, and it's also known as rickets in children. We don't have so much rickets these days because of our diet being so much better, but osteomalacia is the other name for rickets in children. Spinal stenosis is where there's a narrowing of the spinal column due to wear and tear, usually. A whiplash represents a range of injuries really in the neck, and quite often a sudden distortion of the neck, a sudden violent jolt backwards would cause whiplash symptoms. These days with car seat protection, we don't get so much whiplash. Osteogenesis imperfecta. This is a congenital disease known as brittle bone disease in babies. It's also due to malnutrition while being carried in the womb. Psoriatic arthritis is an inflammatory joint disease associated with arthritis. Paget's disease is an abnormal breakdown of bone tissue followed by an abnormal bone formation, and this is known as Paget's disease. A slipped disc is a weakening or tear of the cartilage or the spinal disc in between the vertebrae, and the disc then bulges or sticks out and presses on the spinal cord within the spinal vertebrae and causes excruciating pain. It usually happens on a movement which is a twist and a turn at the same time, which allows the disc to bulge out and press on the nerves. Very painful condition. Carpal tunnel syndrome which we talked about earlier, anything to do with carpal means to do with the wrist, and this is usually a swelling of the tissue of the wrist, which presses then on the median nerve that goes through the wrist into the hand, causing aching, tingling, burning, pins and needles, numbness. It's usually defined by being worse at night and in the morning than at the rest of the time. Quite often people opt to have an operation to cut the median nerve if this continues. Repetitive strain injury, or an RSI, is an umbrella term for an occupational sort of repetitive strain injury. Can be anywhere in the body where you have a sort of tendinitis. It's often mistaken for carpal tunnel syndrome, but it's a non-specific pain syndrome where there's always this same numbness, tingling, sharp pain, aching, loss of grip, weakness, restricted movement. Quite often you can get this in the spine, the neck, the shoulders, and in the wrist as well. When we're going through each system of the body, we need to consider the effects of stress on every system and the effects of stress on the skeletal system. When we become stressed, we tense our muscles, and in tensing our muscles, this causes us poor posture. It might mean that we clench the jaw, hunch the shoulders, our joints become stiff, we have problems with the spine. So these are all symptoms of stress on the skeletal system. ITEC also wants you to think about the links to other systems from the skeletal system. So thinking about how the skeletal system relies on the muscles for leverage and movement. So that's how the muscles and the skeletal system work together. Those muscles wouldn't move and move the bones if we didn't have a nerve stimulus to make that happen. So the brain sends a motor nerve stimulus to move the bones. We wouldn't have any nutrients for each osteocyte to gather nutrients, proteins, fats, carbohydrates. All their cells need to have nutrients in order to function and repair. So that's how the digestive system works with the skeletal system. The urinary system is a little bit more unusual, and when we cover the urinary system, you'll cover this again. But the hormones produced by the kidneys stimulate the production of bone marrow in the long bones. So the bone marrow is stimulated by hormones produced in the kidneys, and that's part of the urinary system. And then the circulatory system. The circulatory system certainly provides oxygen to each living cell in the skeleton. It also takes away carbon dioxide from each living cell as well. But also, not only the erythrocytes are produced in the bone marrow, but also so are the white blood cells and the platelets or thrombocytes as well. So the link to the circulatory system is that the bone marrow produces the blood cells that are needed in the circulatory system. So after every system, we do have to have a think about how this one piece of the jigsaw puzzle that represents the skeletal system fits together with the rest of the jigsaw puzzle to make up the whole body. That's all, folks. Thank you for completing the skeletal system. You do need to take some time to revise before you do the quiz, which is the next slide. And I do need you to be achieving a 60% pass rate on that in order to achieve the skeletal system. So do take some time to go over and revise this before you take the quiz. And don't forget to answer the survey at the end of the quiz afterwards as well. And if you do achieve your 60%, to print off your certificate. If you don't achieve your 60%, I would take your time going through the presentation again, doing some more work. Repetition is the main way. just keep going over those bones and what the diseases are and the key words like the estrogen and the calcium for the osteoporosis. So have a look at the key words that are associated with each system and keep naming and talking about skeletal muscles with your family. Making it part of your everyday life will help. Okay, so good luck with the quiz.